What are the GINA guidelines for asthma severity? Imagine trying to manage a condition that can change from mild to severe over time. That's what asthma can do, and understanding how serious it is helps guide treatment. The Global Initiative for Asthma, or GINA, has set clear rules for figuring out how severe asthma is. They don't just look at how bad symptoms are at diagnosis but consider what kind of treatment is needed to keep it under control over several months. This way, doctors can see the bigger picture of how asthma affects a person's life. GINA divides asthma severity into three main groups. The first is mild asthma. This type is controlled with low doses of inhaled corticosteroids, which are medicines that reduce inflammation in the lungs. People with mild asthma usually have symptoms only twice a week or less during the day. They don't wake up at night because of asthma, and their activity isn't limited. They might use a reliever inhaler sometimes, but it's not needed often. Next is moderate asthma. This level needs a bit more treatment, usually a combination of low to medium doses of inhaled corticosteroids and a long-acting beta-2 agonist. These patients might notice symptoms more often, maybe several times a week, and sometimes their daily activities are affected. They might also wake up at night with asthma symptoms more than twice a month. The most serious is severe asthma. This requires high doses of inhaled corticosteroids along with other controllers, like long-acting beta-2 agonists and sometimes oral corticosteroids. People with severe asthma often have symptoms that don't fully go away even with strong treatment. They may have frequent flare-ups, find it hard to do normal activities, and need emergency care more often. In recent years, GINA has changed its advice about treatment. It no longer recommends using only short-acting beta-2 agonists, which are quick relief inhalers. Relying just on these can increase the risk of severe attacks and even death. Instead, GINA suggests that all patients should use inhaled corticosteroids regularly or when they have symptoms to lower these risks. Doctors check how well asthma is controlled by looking at several things. They consider how often symptoms happen during the day and night, how often a person needs to use their reliever inhaler, if their activity is limited, and how well their lungs are working through tests like forced expiratory volume in 1 second or peak expiratory flow. When classifying severity, doctors look at the worst or most severe feature present. For example, if someone has mild daytime symptoms but wakes up at night often, their asthma is considered more severe because of the nighttime issues. Regular reviews of medication use, inhaler technique, and risk factors like allergies or smoking are important. If asthma isn't controlled, treatment can be increased. If it stays controlled for at least 3 months, treatment might be reduced. This approach helps tailor treatment to each person's needs, aiming to keep symptoms manageable and prevent serious flare-ups. Knowing the severity helps both patients and doctors work together to keep asthma under control and improve quality of life.